Hello.
Hi everyone. Welcome back. How y'all been doing this week?
It's Amanda Hines,
Trachina Greer.
and we represent Mental Health for All. And we're going to continue with our 3-part series on multiple personality disorder or dissociative identity disorder. Today, Ms. Greer is going to talk about dissociation and coping skills and strategies. And then I'm going to follow up with different forms of treatment for DID, dissociative identity disorder, or multiple personality disorder. Also, in layman's terms, split personality. And then I'll also tell you what you can do as a family member if you know someone, you have a loved one that struggles with this issue.
Hi. Okay, I'm going to continue from last week. Because last week I explained and I talked about myself, about how I dissociate with my mood swings and everything else. Okay, the reason this has happened to me is because I had severe trauma as a child. In my early childhood, I had extreme trauma. Repetitive physical, sexual, and emotional abuse. It is also known as a split personality disorder. I have a split personality disorder because, like I said, of the severity of my trauma that I went through as a child. It's mental health process is a lack. It is explained as a lack of connection in your thoughts, memories, feelings, actions, and a sense of identity. The association aspect is a thought to be a coping mechanism. I literally shut myself down and I dissociated with myself, where I could actually see what's going on, but I can't not bring myself together. And this usually happens because I've been through very violent, traumatic, painful situations in my life. And it has assimilated in my self-conscious. I have two or more separate identities, and these are called alter personalities. These personalities control my behaviors at various times. Each alter has its own personal history, traits, likes, and dislikes. And all these that I'm talking to you about, that I'm explaining to you about, is what I go through on a personal level. And that's why we come and we educate people about ourselves, because we talk about from lived experience. I'm talking about from lived experience. And the way that I've learned how to cope with these things is that I have to learn how to bring myself back together, how to recognize my triggers, how to ground myself, put my feet on the ground, grounding myself, grabbing whatever is around me when these things are happening. Okay? A lot of these things are very essential information about life. It could be limited to specific areas of your life. It may include your life history and identity. And it definitely does include that with me. So for now, I'm going to leave it at that. I have more that I have to discuss with you next week, but I will pass it to Amanda.
Okay, so I briefly want to talk about several forms of treatment that are used to address multiple personality disorder issues. 4 are talk therapy, CBT or cognitive behavioral therapy, family therapy, and psychotherapy. And psychotherapy is basically the umbrella under which all of these forms of therapy fall under. So basically, psychotherapy is basically just one-to-one with the person suffering from this disorder, and a licensed mental health professional. And the primary goal of psychotherapy, as well as the other therapies, is to identify and then change troubling emotions, thoughts, and behaviors. And that's the foundation. Now, talk therapy is where you identify and change troubling emotions, thoughts, and behaviors as well by just talking about your issues. And during a session, the professional is going to try to help the person to understand the connection between the emotions, the thoughts, and the behaviors. Now, CBT, or cognitive behavioral therapy, is actually goes a little bit deeper. So it not just focuses on the thoughts and emotions that are triggered by these thoughts, as in talk therapy, but it tries to identify the situations that may also cause it. So, for instance, one form of CBT would be, let's say you have anxiety. So you would repeatedly expose yourself to situations that cause anxiety for you. So, like, let's say that you don't like to be in crowds. So you would, on a regular basis, try to put yourself in a situation where you're exposed to that. And what it does is it desensitizes you to that.
Sorry about that, y'all. We had a little glitch.
So part of CBT would be to expose yourself to crowds, so you become desensitized to it having that kind of effect and creating anxiety within you. Other examples would be to journal your thoughts, and then what kind of feelings come up for you when you have these thoughts, and what triggers these thoughts as well. So again, talk therapy is just trying to make that connection between your thoughts and your emotions, whereas CBT is more like trying to identify the root cause of what causes certain issues within you and exposing yourself to it, or being aware of it. And finally, family therapy involves a therapist, and this is where members of the family in totality, or as many people as possible, would come together, and the therapist tries to analyze or evaluate their views and their relationships, of each family member, and how all of this comes into play. And the primary goal is to provide support for the individual that is experiencing this disorder in order to prevent relapse. So those are the forms. Now, if you know someone, you have a loved one, friend, family member who has this disorder, some of the things, sometimes you may feel powerless, but there actually are things that you can do. So one of the primary things you can do is to educate yourself about DID, or dissociative identity disorder, also known as multiple personality disorder. You can meet them where they are. So don't try to place expectations on them, because you got to understand where they're coming from. You can listen to them. Listen to them without judgment. Try to listen to understand, not to respond, and offer support. Also, you can try to connect them to support services within the community, because sometimes they may not want to take the initiative. Maybe they feel fearful, or maybe they don't even think that there is help out there. So finally, if you know someone, you definitely want to address issues about self-harm and suicidal behavior, because these things can come up with this disorder as well. So I hope this was helpful for you guys. We were going to do 3 parts, but next week we are going to continue. This should be our final session on multiple personality disorder, and we're going to make sure that we get you up to speed, and we leave you with some tools so that if you suffer from it or someone you love suffers from it, you guys will be empowered to make positive, effective changes in your life. So thanks again for staying tuned.
Come back next
See
week.
you next week. And don't remember to like and share.
Please like and share. Bye-bye now.
Bye.